Sometimes in life you meet the most extraordinary people and are lucky enough to become part of their life. That happened to me with Dr Daniel Nour. As well as saving lives as a doctor working in a hospital, he spends his spare time helping the homeless as part of his Streetside Medics project. Take a look. Dr Daniel Nour, thank you so much for joining us on Erin. Why Streetside Medics?
Because there's an unmet need in the community that needed to be addressed. I learned early on as a final year med student that there were people experiencing homelessness, and as a result of that they faced significant challenging barriers that limited access to healthcare, and they were suffering in silence in our society. And from what I could see, and certainly from what I could hear from the people on the ground, that there was an unmet need. And therefore something needed to be done about it. And I'm a big believer in, if you feel like you can do something about it, then you might as well give it a go.
When we talk about the problem with homelessness, the biggest issue is a lack of a home, obviously, but there are so many other challenges and factors, and health would have to be right up there.
Yeah, I mean, there's a lot of statistics which suggest that a lot of people experience homelessness as a result of health conditions, but also a lot of people stay homeless as a result of health conditions. That doesn't have to be just mental health either. That includes chronic physical conditions and conditions that limit them in their ability to break that cycle of homelessness. And that's a very much part of what Streetside Medics tries to do, is break that cycle of homelessness.
So what kind of issues are we talking about here? Are they extreme or really basic day-to-day things that most of us would either take care of ourselves or go to our GP for?
Yeah, look, I think we see a very wide range of presentations, but it's certainly things that include chronic conditions, diabetes, heart failure, thyroid issues, respiratory issues, but also includes things. I mean, we had a patient that we saw in Manly who had severe back pain as well as leg weakness that was limiting his ability to get a job, and as a result of that became homeless. He was misdiagnosed, he was living on the streets. He met one of the Streetside Medics team who were a little bit more neurology inclined, realised that something was quite seriously wrong, and referred him to a hospital where he was seen by a neurologist, and fast track a few months later he's now got his mobility back, he's physically able to get a job again, and that cycle has been broken. And being there, the right place at the right time, and ensuring that access to healthcare is optimised was really the key answer to that problem.
There's so much humanity in what you do, but there's also a real legitimate financial benefit to this service when it comes to what the taxpayer is funding. And you look at even a night in ICU, I think around $10,000. Yeah. People are going there presenting with things that don't require that kind of service. How are you saving this country money? Yeah,
so primary healthcare is a model that's been around for years and has always been about helping an individual, but also has been a financial and economical model. It is preventing a condition from becoming worse than it has the potential to. It's diagnosing diabetes early or preventing it from happening, rather than it coming in with the severe complications that it know that it can. And that's a wide range of conditions that is relatable towards. It's a very good example. So if we diagnose someone with diabetes early on, that might only cost somewhere between $50 to $100. But if they present to the emergency department, you're talking thousands of dollars. And if they're unwell with a complication of diabetes, whether it be a heart condition or a vascular condition, you're talking thousands and thousands and thousands of dollars. And we can prevent that. We can prevent that for the entire community, but certainly for those who aren't accessing the healthcare system.
It's not just the homeless, it's vulnerable people, and we're here in a fairly significant social housing zone. Yeah. And you were talking about children, and for me the thought of a child either suffering or not getting the help they need breaks my heart. You see these people firsthand, you and your volunteers. Does that stay with you long afterwards?
Yeah, I think that that humanity, that vulnerability is what keeps us going and what drives us after work and busy lives to continue coming back. But we're on a mission and we've got a goal. It's ensuring that healthcare is accessible for anyone and everyone. And the fortunate thing about Streetside Medics is hundreds of volunteers have bought into that vision. And even tonight, we're in Surrey Hills, we've got skilled volunteers who've worked a full day of work at hospital, but they've come to a clinic after hours because they believe in a mission. They believe in ensuring that there aren't people who are suffering in silence in our community. And we're driven by that. And sure, we see difficult situations and circumstances that we wish weren't happening, but we're more focused on improving it rather than just identifying the problem.
Domestic violence, I suspect, would be a fairly big issue that you'd encounter?
Yeah, absolutely. I think COVID, there was an increase in domestic violence, and we saw certainly, especially for some reason in our Northern Beaches and Manly area, there was an increase in women coming to us complaining of domestic violence, and as a result of that we have started a clinic specifically for women who are in women's shelters, in a women's shelter up in that area, and made sure that we can provide a service that is to some degree de-identified, where someone can go and see a doctor without being worried that someone is following them or seeing them, and without, you know, the notion of waiting in a medical centre and people asking why you're here and what's going on.
What's broken your heart?
Yeah, I think that's a tough question. I think a few things. I think we've got a lot of people that support street side medics, but there are also people who suggest that it's a service that's not needed, and that it is what it is, and I think that breaks my heart, because it suggests that we've lost faith and we've lost our sense of humanity. We're too focused on ourselves rather than the community. That's broken my heart. And I think there have been some individual circumstances of people that have just done it tough. And certainly relatable people. I mean, I spoke about recently a 20-year-old gentleman who is an illegal refugee, who came and saw our clinic not as a patient but wanting to volunteer with us because he just wanted to give back. And I couldn't help but compare myself to him. He is younger than me, but he was unfortunately born overseas. And he was born to a family that to some degree disowned him, and now he finds himself in this difficult situation. And I think we don't realise how lucky we are sometimes.
It's incredible. One other thing that you've said, and we know each other very well, and I've heard you speak multiple times, and it's just such a privilege every time I do, but you said to people out there in a way that they can help, acknowledge homeless people. Say hello. If they ask you for money, say, I'm sorry, I don't have any. If you don't just pretend they don't exist. And that really touched me.
I think it's the one question that I always ask is, what more can we do when we were interacting with people experiencing homelessness? And it was just recognition. Just realise that I'm here and that I'm a human, and maybe I've fallen on tough times, or maybe I just want to live like this. But just recognise that I'm here and just have a conversation. And I think that they are the most emotionally intelligent people, and they know when someone is there for genuine reasons or not. And they can tell when someone really wants to help them. And I think showing them that you care is the most you can do.
What do you need? You need more money, you need more government money, you need more corporate money, you need individual volunteers, donations. What do you need to keep this going and to grow this?
Yeah, all the above, all the above. And I think the biggest thing we need is a recognition of the need of the service. There are people doing it tough in our cities, and I think when people think of homelessness, they often think of food and shelter, and my role is to make people aware that healthcare should be part of that equation. We should be thinking about food, we should be thinking about shelter, we should be thinking about their healthcare. And recognition of people's healthcare who are experiencing homelessness is the first step to improving their health.
Oh, it's incredible. It's such an honour to know you, and thank you so much for the service you're providing.
Pleasure.